Good afternoon, and thank you for joining. I'm Sherilyn Francis with the Optimal Health and Wellness Clinic, where we treat the underlying causes of disease. We invite you to connect with us via social media at OHWC_MSM. At the Optimal Health and Wellness Clinic, we offer an integrative care approach to chronic disease management. The 4 pillars of the clinic are plant-based nutrition, stress management, physical activity, and sleep hygiene. At the Optimal Health and Wellness Clinic, our treatment goals are to prevent new chronic disease, reverse existing chronic diseases, decrease the need for multiple medications, and to reduce incidence of adverse drug reaction in sensitive patients, and to improve outcomes when patients are non-compliant with medications. And now a few housekeeping measures. As participants, your microphones are muted and shall remain muted through the duration of the presentation. We ask that you check your internet connection, and this icon can be found in the upper right corner of your screen. An optimal internet connection will ensure that you have ideal audio and video during this experience. We ask that you refer all tech issues to the tech support chat pod, and we ask that you refer all presenter questions to the presenter Q&A pod. There will be periodic stopping points for Q&A. However, the format of today's webinar is a panel discussion, so you're free to submit questions throughout the entirety of the presentation. Additionally, following today's webinar, each registrant will receive the webinar presentation and the webinar recording via email. I now present to you today's webinar entitled Plant-Based Diets for Optimal Health. Today's moderator will be Kayellen Hare, instructional designer, and the webinar panelists will be Jennifer Rooke, assistant professor, Department of Community Health and Preventive Medicine, Morehouse School of Medicine, and Ms. Kay Edmonds, Umeakunne, bionutritional research manager, Morehouse School of Medicine, Clinical Research Center. And now, Mr. Hare.
Thank you, Sherilyn. My name is Kayellen, and it's my pleasure to moderate this discussion on the plant-based diet and patient treatment. Here we have a slide with the objectives for today. You can take a moment to read those. We'll definitely touch on all these topics. But I want to say that to begin, Dr. Rooke and Ms. Umeakunne will each make a short presentation, about 10 minutes apiece, in which they'll discuss the plant-based diet and prevention of chronic diseases and provide guidance on adopting the plant-based diet. Also, you all have submitted a lot of questions. We've collected those and kind of put them in separate buckets. And at the end of our presenters' presentations, we'll get to those questions. So if you've had a moment to review the objectives, I'm going to move this slide to the first slide of Dr. Rooke's presentation and hand it off to Dr. Rooke.
Good afternoon, everyone, and thanks for the introduction. Plant-based, in our clinic, where the main therapeutic intervention is plant-based nutrition. We also offer sleep hygiene, stress management, physical activity as support, but we see the most impact when patients transition to a plant-based diet. Now, there are lots of reasons for transitioning to a plant-based diet. Plant-based diets improve overall health, but the condition that we are most concerned about and we have the most evidence for is atherosclerosis. Atherosclerosis is probably the most common cause of death on Earth, and it's probably the most common disease. I'm trying to move my slide along. Yeah, the most common cause of disease. Oops. Right. So if you combine if you look at the Centers for Disease Control and Prevention, they report deaths in their deaths, cardiovascular disease is the most common cause of death. The World Health Organization, also heart attacks and strokes are very high on the list. Now, if we combine all of the deaths from ischemic heart disease, cardiovascular disease is lumped by the CDC, and strokes, you will find that cardiovascular disease is the most common cause of death worldwide. The underlying disease for cardiovascular disease is actually atherosclerosis. And most people, we don't really think about atherosclerosis when we think about heart attacks and strokes, but that is the disease that if we could prevent or reverse, we would prevent heart attacks and strokes. So what is atherosclerosis? And that's my next slide. She's not moving along. So what is atherosclerosis? Atherosclerosis is commonly known as clogged arteries. You can see the arteries are clogged basically by abscesses. We have under the lining of the arteries, there is usually a collection of basically fatty tissue, fatty foam cells that are filled with fat. Now, atherosclerosis leads to heart attacks and strokes. Now, if the artery going to the heart is blocked, if the artery going to the heart is blocked, you'll get a heart attack. If the artery going to the brain is blocked, you will get a stroke. Now, but aside from heart attacks and strokes, we're having some difficulty here with the slides. I'm not sure why they're jumping. Now, but so that's an end outcome, heart attacks and strokes. But before we get to heart attacks and strokes, decreased blood flow caused by blocked arteries actually can lead to several conditions, such as high blood pressure. When the kidneys don't get sufficient blood flow, there is a sensor mechanism which tells basically the kidneys that we need to maintain fluid, to retain fluid. When we retain fluid, our blood pressures go up, and that leads to hypertension in some cases. I'm not sure why we're having difficulty with the slides, but when there's decreased blood flow to the brain, can cause brain fog, and it can cause vascular dementia over time. There we go. Vascular dementia over time, and there's a lot of interesting research now which shows that decreased blood flow to the memory centers of the brain may contribute to Alzheimer's disease. And of course, decreased blood flow to the penis can cause erectile dysfunction. The next slide. Next slide. Okay, so there's a lot of interesting research now about what actually causes. So we know that cholesterol causes atherosclerosis. So, from studies with rabbits in 2013, since 1913, we've known that if you fed rabbits high cholesterol foods, they would develop atherosclerotic plaques. The Russian pathologists actually didn't know what about the animal products was causing that, so they extracted cholesterol and fed cholesterol to the rabbits, and found that cholesterol was the ingredient, was the component of plant-based, of animal foods that actually was causing the atherosclerosis. Now, they weren't actually sure how cholesterol does that, because cholesterol is made by our bodies. Cholesterol is an important part of basically all of our normal functions. Cholesterol makes our hormones. cholesterol is in the cell wall of, in the cell membranes of all of our cells. Cholesterol is a very important compound. So there's been a lot of controversy about whether or not cholesterol was really the problem. And in recent years, there's been really, really interesting research about what specifically causes cholesterol to then lead to atherosclerosis. It was thought that high levels of cholesterol caused atherosclerosis, but now we know that it's really the oxidation products of cholesterol that actually causes atherosclerosis. So when cholesterol is exposed to air through heating, cooking, irradiation, or any type of processing, it becomes oxidized. And these cholesterol oxidation products are sort of mechanically different. They're so different from real cholesterol that our bodies recognize them as foreign and toxic. Now, and so there's been lots of also good research about the cholesterol oxidation product in food, the amounts of cholesterol oxidation in products in foods. So a raw egg basically has very little cholesterol oxidation products, whereas a cooked egg or the powdered eggs that you have at McDonald's, very high levels. Processed meat, processed bacon, sausages, high levels of oxidized cholesterol. And this is what's recognized by our bodies as toxic. I'm trying to move the slide. Right. So our bodies, so we know that our bodies basically recognize our cholesterol as being normal, and our immune system does not form antibodies to our own cholesterol or native cholesterol. But when cholesterol is oxidized, it forms, in some cases, it forms crystals, and those cholesterol crystals actually are recognized by our macrophages or cells as toxic, and our immune cells, primarily monocytes. And just a quick review, monocytes are our immune cells that circulate and try to get rid of any type of toxins or harmful substances in our bloodstream. When our bodies recognize a toxin, they sort of engulf it they engulf it and try to basically get rid of it. Now, the two really great articles that were published in 2010 found that when we eat foods such as bacon, or when we eat foods that contain oxidized cholesterol, they also form crystals that actually go into and under the lining of the arteries, down between the endothelial cells of our arteries, and of course circulate. Our immune system responds to that by gobbling them up. Or LDLs have been sort of demonized for many years, but actually our LDLs pick up the oxidized cholesterol, not our native cholesterol, but LDLs pick up the oxidized cholesterol that comes from food and then and circulates with that. That goes between the spaces between the endothelial cells and are gobbled up by monocytes that become macrophages, and that is what causes foam cells to form. Now, if you when you see atherosclerotic plaques are primarily filled with foam cells, and foam cells are macrophages that have basically engulfed lots and lots of oxidized cholesterol and oxidized LDL. Well, we say oxidized LDL, but it's actually oxidized LDLs that are carrying oxidized cholesterol primarily. And so this is the sort of process that we see over time with the formation of atherosclerotic plaques. Now, this is all very brand new, interesting research about cholesterol crystals, that they had been seeing cholesterol crystals in atherosclerotic plaques for many, many years now, but they thought that it was something that had been formed when the foam cells died and released cholesterol and released oxidized cholesterol, and it formed crystals. But now we know that the crystals are an early part of atherosclerotic plaque formation, and it's also an interesting late part of plaque formation and plaque rupture, because the crystals coalesce and form large crystals that puncture the fibrous cap in plaques. So, and that then causes plaque rupture. So this is the mechanism by which we get heart attacks and, again, strokes. If this happens in an artery that's going to the brain, we will get a stroke. If it happens in an artery that's going to the heart, again, we'll get a heart attack. So this is so this is how oxidized cholesterol forms atherosclerotic plaques. Now, this is a very simple slide. I try to simplify this for my patients, and about how oxidized cholesterol, but it's not just oxidized cholesterol, it's part of the problem with diabetes. With diabetes, the main problem with diabetes is that our liver is making too much glucose. And basically we have high fasting blood glucose levels. That's the main problem. I mean, so when you test the blood glucose is high. Now, insulin is supposed to stop your liver from making glucose, and it's supposed to send glucose into the cells. So, how we look at this is look at from lifestyle factors. So there are different ways to look at this, but we're looking at this from how lifestyle changes and plant-based diet could help to reverse diabetes, because we've seen this. We know that when we take our patients off animal products, that they actually get much better. Their blood glucose levels go down, the hemoglobin A1C levels go down, and it's pretty dramatic what we've seen. So this is I sort of devised this slide to sort of explain it to my patients how that could happen. And so insulin is supposed to stop your liver from making glucose, but there are 5 reasons here why insulin may not actually be able to do that. Number 1, a high-fat diet actually stimulates glucagon, which opposes insulin. Oxidized cholesterol in the diet, and this is new research that I can share with you. Oxidized cholesterol may actually damage beta cells of the pancreas, and then they produce less insulin. Obesity. So obesity is blamed for a lot of diabetes, and it is one of the main causes, because too much fat in the cells actually stop insulin from working properly, and animal products. So this one is a little bit controversial, because I try to explain this, and there's research that supports this, again, which I can share with you, that before an animal dies, it surges cortisol. Cortisol stays in the tissues. The half-life of cortisol is 90 minutes. Then the cell dies within 4 minutes. So cortisol stays in the tissues, and when we eat animal products, we're actually taking in the cortisol, and cortisol is absorbed by diffusion. Now, after every single protein meal, there is a rise in cortisol. And that rise in cortisol does affect our glucose tolerance tests, and it affects blood glucose levels. So decreasing animal products in the diet actually decreases that the continuous spike in cortisol. Fear and stress also increase cortisol levels, and that blocks insulin. Cortisol is the fight or flight hormone. It blocks insulin to keep to keep glucose in the bloodstream for fighting or running away, basically, if you're under sort of a stressful or fearful situation. So cortisol, those are the 5 sort of areas where we believe that changing your lifestyle, a plant-based diet, and stress management actually decrease your risk or help you to reverse diabetes.
Dr. Rooke, thank you
then,
for the time. We are going to transition to Ms. Umeakunne, but we will have an opportunity to address your final points during the Q&A with the participants, because we have lots of questions to cover exactly what you're referencing.
Okay, good afternoon. I am going to provide some information on evidence supporting the health benefits of a plant-based diet. Focusing on African Americans, but those who enjoy Southern cuisine will also be eating a similar type of diet, so this will apply to a broader base. So, some of the research that I would like to present today have to do with studies that have looked at the effect of dietary intake and dietary pattern on cardiometabolic risk factors. This study was done as a Jackson, Mississippi heart study, and they looked at prudent diet, which is what they classified as a more healthy diet versus a fast food diet, and a Southern cuisine diet enjoyed by African Americans and other Southerners alike. They looked at the effect of those diets and risks for hypertension, impaired glucose, diabetes, high triglycerides, low HDL cholesterol, and metabolic syndrome. In addition, they looked at risk factors for high visceral adipose tissue, which is the tissue that is in and around abdominal organs. And this slide is pretty busy, but if you look at the results for risk based on these 3 diet types, there was an increased risk for visceral adipose tissue with Southern diet, which is high in fat, high in sodium, high in saturated fat. Fast food diet, the only one that was lower in risk for that was the prudent diet. For hypertension, for impaired glucose, diabetes, triglycerides, low HDL cholesterol, and metabolic syndrome, you can see that a similar pattern of risk increase from the prudent diet to fast food to the Southern diet being the highest, with the exception of metabolic syndrome, where the fast food diet provided the greatest risk for metabolic syndrome. Plant-based diets have been studied early on in Seventh-day Adventist groups because the majority of Seventh-day Adventists adhere to a plant-based diet. Those can be broken down into lacto-vegetarian, which is just milk products, ovo-vegetarians, egg products, or completely vegan, entirely plant-based, without any animal origin products. And so today we're going to focus on plant-based. Vegan is also associated with other kinds of sociological or philosophical components, but for the purpose of this lecture, we're going to focus on plant-based diets for health. So even when you look at the difference between vegetarian type, totally plant-based versus lacto-ovo vegetarians, there is an advantage that has been shown in this study by Sabate and colleagues out at the University of Loma Linda in California. There is still an advantage of having a totally plant-based diet as far as risk for body mass index, hypertension, diabetes, and this is strong in both African Americans and those who are not African American. One of the classical studies that was done that brought vegetarian or plant-based diets into the forefront, mainstream acceptance by the USDA, is a study that was done by Dr. Barnard and colleagues in the Physicians Committee for Responsible Medicine. They looked at a low-fat, plant-based diet, which is synonymous with a vegan diet. I'm going to use plant-based for all purposes here, versus a conventional diabetes diet. And basically, the conventional diabetes diet is about 15 to 20% protein, less than 7% saturated fat, 60 to 70% carbohydrate, and about 25% fat. Also, because the conventional diabetes diet does include animal products, the goal is less than 200 milligrams of cholesterol. The low-fat vegan diet or plant-based diet that was used with only 10% of calories from fat, 15% protein, 75% carbohydrate. So the main difference in these two diets, no animal products in the plant-based vegan diet versus animal products and a higher fat intake, as well as cholesterol in the conventional diabetes diet. 99 persons completed this study. Roughly 50%, 49 in the vegan group or plant-based group, and 50 in the conventional group. And after the 74 weeks, they showed dramatic difference in the reduction in hemoglobin A1C, especially in the totally plant-based group. What was interesting about this study is that they were freely allowed to consume carbohydrates, something that in our conventional previous wisdom has been restricted for diabetes. Also for this study, they also showed other health benefits of some weight loss, not too much dissimilar between the two groups. Calorie levels initially were around 1,800 with a 500 calorie deficit to promote weight loss in the two groups. Those were similar. But there was a difference in the fat intake decreasing more significantly as far as intake in the plant-based group. These, if you have a question about how they were able to assess their intake, these were free living people who were able to consume what their guidelines were for each type of diet without having to have it provided for them. In other words, these weren't diets that were prepared and provided to these participants. Both groups, however, were given the vitamin B12 supplement to ensure that vitamin B12 was provided in the recommended amounts throughout the study time period. But what happened with this study, it was sort of like a very classic and well scientifically done study that enabled vegetarian diets to now be listed in the USDA 2015 guidelines for Americans. So we also know that position papers have been developed for plant-based diets being ideal and adequate, and even help to reduce and sometimes reverse some chronic disease symptoms in the American population. In addition to the United States, Canada and Europe have numerous studies showing support for use of plant-based diets now in adjuvant therapy and also in treatment for chronic diseases. Getting back to my focus on how do you start on a plant-based diet, what are some of the key components that would be of interest to not only African Americans, all Americans actually, and particularly those in the South and other ethnic populations. Some of the nutrients that affect high blood pressure, we know are potassium, calcium, magnesium, and fiber. We know that across the United States there's a very low fiber intake of only around 9 grams per day. Magnesium is low, only about 190 per day. Calcium is low, and also potassium. With a plant-based diet, it is easy to achieve these minerals and fiber that help, as demonstrated by the success of the DASH diet, in lowering blood pressure, and also it can be used to help with diabetes and also other chronic conditions such as high cholesterolemia. So if you can see in some of these pictures here, I've provided some foods that will supply adequate mineral intake and fiber-rich intake for populations that would like to adhere to a plant-based diet. And I want to say for the calcium, a lot of people think that calcium is just in dairy products, but there are a lot of foods, plant-based foods that we eat that have a lot of calcium. The only plant that really, many claim is calcium rich, that doesn't have bioavailability would be spinach. So that one, not so much, because the bioavailability of the calcium from the spinach is not the same. But you can see there is no reason why you can't get these nutrients from adhering to a plant-based diet. Some of the other key important food sources of vital nutrients for plant-based diets involve some of our micronutrients, such as selenium and zinc. And it's very easy to get these nutrients as well. I have a list here: brown rice, wheat bread, whole grain bread, baked beans, some products that are enriched with selenium, but you can also get it from lentils, cashews, zinc from, if you need to have a good source, fortified breakfast cereals, but also from chickpeas, oatmeal, and almonds. Your zinc requirement is only 11 milligrams per day for selenium, 55 micrograms. When we move over to vitamin E, another one requirement of 15 milligrams or 22.5 international units. In addition to the sources I've listed here, you can also get vitamin E from avocados and leafy greens. Now, as far as vitamin B12, this has been one of the nutrients that's been controversial. Plant-based diets do need to include some type of source, a reliable source of vitamin B12. And I put the Red Star nutritional yeast on there because I want to talk about that. That nutritional yeast, while it's been claimed to have adequate B12, it's not a reliable source. The most reliable sources are to take either B12 supplement, fortified cereals, or other fortified plant-based milks in order to get just 6 micrograms of vitamin B12. And a lot of supplements provide more than that. Vitamin D is another one. The best source of vitamin D, of course, is from sunshine or skin food. We know that across the country, we have lower levels of vitamin D found in African Americans, but also in other ethnic groups because of the latitude and also from our amount of melanin in our skin and availability for absorption. Sources for vitamin D include fortified plant-based milks from the diet, fortified cereals, fortified orange juice. Get outside for at least 15 minutes per day in some sunshine. The requirement for vitamin D is 600 international units, but it's recommended now that 1,000 to 2,000 is what you need in order to be able to meet your levels for vitamin D. So I want to just talk a little about some of the good resources that are out there to get you started. The Physicians Committee for Responsible Medicine has a wonderful publication called Vegetarian Starter Kit. And in that, you have a guideline of how to format your plate, which involves fruits, legumes, whole grains, and vegetables, in order to meet all of those requirements that you need. Protein is not a problem on a plant-based diet. You have plenty of protein from nuts, seeds, legumes, just a variety. And you do not have to complement proteins as was thought of years ago. If you eat a variety of foods containing proteins, you are going to meet those requirements. Also, resources, the Academy of Nutrition and Dietetics, Vegetarian Dietetics Practice Group has a wonderful website, vegetariannutrition.net. For professionals, we have a consumer website, which I just mentioned, vegetariannutrition.net. Professional healthcare providers, vndpg.org. We're even on Facebook at Vegetarian Nutrition. We have a certificate of training program in vegetarian nutrition, and we also have an official position paper on vegetarian or plant-based diets through the Academy of Nutrition and Dietetics. Our alliances are with the Vegetarian Resource Group, who also has a wealth of information. The Physicians Committee for Responsible Medicine has excellent materials and resources. Vegetarian magazines include Vegetarian Times. One of my favorite books is by registered dietitian Brenda Davis and Basanto Molina, both registered dietitians, Becoming Vegan. It's a comprehensive edition with numerous well-controlled studies providing scientific evidence for plant-based diets, and it's a complete reference to plant-based nutrition. And so with that, I am going to finish my presentation. Thank you very much.